Module 3, Personal Care, Part 2. Oral care. Oral cares are the methods used to care for the mouth, teeth, and gums. This can include brushing teeth, the tongue, and gums, as well as flossing. As a nurse aide, you will also need to care for dentures and partial dentures. Gloves will need to be worn when doing oral care. Can you remember why? The answer is because we are working with mucous membranes that are potentially infectious as a portal of exit for microorganisms, but also the mucous membranes are the potential portal of entry for the resident. Oral cares have many benefits. By brushing off plaque on the teeth, we may help prevent tartar, which is filled with bacteria and can cause gum disease. Gingivitis is an inflammation of the gums. If left untreated, gingivitis can cause pain and may lead to tooth loss. Brushing teeth twice a day will help maintain oral health, which will improve a resident's self-esteem. But it will also help prevent mouth odor that is caused by poor oral hygiene. With continued professional cleaning, a resident may be able to keep their own teeth for as long as they live. Nurse aides should observe and report the following during oral care: lips that are very dry, cracked, bleeding, or chapped, swollen and irritated gums, this could be the first sign of gingivitis, loose, cracked, chipped, broken, or decayed teeth are a potential hazard for a resident. Not only can a resident accidentally swallow a tooth, the loose tooth may cause the resident pain and prevent them from eating. Canker sores can be very painful and may cause the resident to decline to eat or drink also. White spots could mean that a resident has a condition called thrush, which is a fungal infection in the mouth. They may also have strep throat, and you may see spots located around the tonsils. Report any changes or complaints of pain to the nurse right away. Typically, oral care is conducted in the morning and then again in the evening. This slide indicates that oral care may need to be offered more frequently when the resident is unconscious. The nurse aide will then use an oral swab to lightly moisten the mouth and prevent it from drying out. After a resident has had vomiting, it is wise to offer oral care, or even a sip of water for rinsing. The acid may be very uncomfortable for the resident in their mouth. Residents with a high temperature or fever may need more oral care to prevent their mouth from drying out. Residents that breathe only through their mouth can dry their mouth out very quickly, and so frequent oral care can bring comfort to them. Many people who are in the active phase of dying will often begin to breathe through their mouth. When this occurs, many care plans will state to perform oral care every 2 hours. Dentures are artificial teeth. Some are full sets of teeth, meaning that there is a top and a bottom. Some may have either a top or bottom or a bridge, which is a dental appliance that replaces the missing teeth. Any type of dental appliance is very expensive, and it is a custom-made appliance. If dentures become lost, it is now the responsibility of the nursing home to replace them. While working with dentures, gloves should be worn to prevent infection. Dentures and bridges should be kept in a labeled denture cup for each resident. We fill those cups with lukewarm water to prevent the dentures from drying out and cracking. Do not use hot water, as this can cause dentures to warp. Always make sure that the denture is the right denture for the right resident. Check the label of the denture cup and the label on the denture if it has one. Edentulous means without teeth. Part of denture care involves swabbing the mouth of the resident at least once a day when they have removed their dentures. Unconscious oral care is a skill done typically every 2 hours and as needed per the care plan. Frequent oral care helps keep the mouth clean and moist. Aspiration, which is inhaling food, fluid, or foreign material into the lungs, is the primary risk for the person who is unconscious. To prevent aspiration during unconscious oral care, use as little liquid as possible by squeezing excess fluid out of the oral swab. Although it may appear that the resident is not coherent, they still may be able to hear. Always explain what you are doing to all residents, including the unconscious resident. Grooming. Grooming is a very important part of the residents' ADLs as it helps make them feel good by looking good. For purposes of CNA training, the grooming skill means to have the hair combed and glasses cleaned to the resident's liking. Allow the resident to do as much as they can for themselves or help them. Follow their preference with how they want to look. Shaving. Shaving is another skill that you will need to be trained. Always wear gloves as there may be a risk for bleeding. Most residents will have an electric razor that does not require the use of shaving cream. Other possible types of razors include disposable razors and safety razors. Disposable razors are used typically once and then discarded in a sharps container. Aftershave can be applied per the resident's request. Never share razors between residents. Nail care is best done during the bathing process, as the nails are softer after being soaked and easier to work with. When doing nail care, we allow the nails to soak. An orange wood stick is then used for cleaning. An orange wood stick looks like a toothpick or a pencil without any lead. The orange wood stick is used to clean under the nails and perhaps to push back the cuticles. Nurse aides do not trim or cut nails. Nurses are the only ones taking on that responsibility, as if there is a nick from the clippers, the nurse will need to address the wound immediately. Some residents have poor circulation and their bleeding is not going to stop. Instead, nurse aides may use a file or emery board to keep edges of the nail smooth. All nail equipment should be used on just one resident to prevent infection. Hair care is a personal expression of each person. Allow residents to style their own hair if they can, or assist them in styling their hair the way they want it styled. Do not comb residents' hair in a childish manner. It may be helpful to look at pictures of how the resident used to style their hair. Always be gentle when working with the hair if it is long. Begin to comb the hair from the ends toward the scalp to detangle it. Dressing and undressing residents can be challenging if working with a resident with weakness on either side of their body or if their whole body is affected. If dressing a resident with a weak side, put on the weak side first. If you need to undress the resident with a weak side, take off the strong side first. We continue to encourage residents to help as much as they can with dressing and undressing. They may be able to button buttons or zip up zippers. Allow them to choose their clothing, perhaps offering two choices if dealing with dementia. Always provide privacy when dressing and undressing. Clothing that is soiled or wet needs to be changed according to the law. However, it is the resident's right to decline to be changed, but documentation would need to be written that the resident did not want to be changed. During the day, residents may need several dressing changes of clothing. Elimination needs. We will be talking about elimination in detail later in this training. Right now, please know that there are other types of equipment besides toilets available to address elimination needs. Urinals are handheld containers that males can have placed for their penis to collect urine. Bedpans are equipment that are placed under a person's butt while they are in bed. The pan can collect both urine and feces. A fracture pan is a slightly smaller version of a bedpan. It is used especially for individuals that have had a recent hip surgery or cannot lift their hips. A commode is basically a portable toilet. It's not hooked up to plumbing. Most commodes are plastic on wheels for easy transportation. Once a resident is done using a commode, nurse aides will then empty the bucket and clean the urine and feces from it and dispose it according to their facility. As a nurse aide, you have the responsibility to report the resident's urine and feces. You will need to note normal color, clarity, odor, sediment, and amounts. You need to know normal so that you can detect what is not normal. Normal urine should be light yellow, and it should not be cloudy or have any mucus or other types of sediment. The odor should not be strong or offensive. Sometimes the amount may also need to be recorded as output. Output will be put on a care plan. Feces also need to be observed. Every day the resident is asked if they have had a bowel movement. If they are independent with their cares, we need to ask them. Otherwise, staff will record results as they help residents evacuate their bowels. Results include noting the consistency. Is it liquid or is it formed? Is it hard? An approximate size, we just say small, medium, or large, etc. And if there was any complaint of pain or discomfort when they had their bowels moved.